Good morning.
Go on, Linda, with your little jives. Fan and surgery, Cara speaking, how can I help? Did you have a lot of sugar?
I love sugar.
So I said to him, you need to stop that.
Have you thought about bariatric surgery?
I'm telling you what, you give me that with it today. Send me now.
So how much do you drink?
Whoa.
And you've tried giving up in the past?
No, never. I enjoy it.
Even though you know it's affecting your chest?
So I had a couple more food then.
Yeah, but it's not just about proportions, but it's also about what you're eating as well, and also exercising, so going for walks. I mean, where there's a will, there's a way.
I must say that puppy is sounding more attractive.
He can't bend over to do his shoes up. How's he going to bend over to look after a puppy?
Bariatric surgery, how can I help? Do you know what? I just want to have a coffee with some cake and cream.
Cake. She wants some cake.
We can't have cake. Cake is fattening.
Cake and cream.
Cake.
Cake is fattening.
Can I check your weight and then I'll check your blood pressure? Sorry.
I don't have to look. No, you don't have to.
So your weight was that?
2 kilos heavier than yesterday. I knew I shouldn't have eaten that bread today.
The number one thing you can do is lose some weight.
I need that as well. I'm fasting, but it's
Okay,
not doing
yeah.
anything.
So that puts your BMI, your body mass index, at 26.4.
Yeah, I feel it here. Look, here, here.
So you have put on quite a lot of weight.
Oh my God, 20k! Look how heavy I am.
All right, he's gonna die.
Good. You're doing all right, young man. Good man.
How are you doing?
I'm quite all right. As
Good.
you can imagine, dress sizes.
Well, you've lost a lot of weight, haven't you? Right, so what did they say your weight was? Come on. You trying that?
Sure. Yeah, sure. Right, okay, here we go.
84. Yeah.
Better than 86.
Yeah. Well, that's 10 kg in May, June. That's 10 kg in 2 months. That's amazing.
Yeah, it's just a game of willpower from what I see.
Yeah.
Yeah, that's what it is.
That is amazing.
My friends are amazed.
Okay.
My colleagues at work are amazed.
But, I mean, you've done incredibly well. Your weight loss is amazing, so...
Yeah, it's been through a very strict diet control. No meat. I do have chicken once a week, fish twice a week, and yeah, absolutely no alcohol. Yes, so I've really cut down on everything.
So you're doing the paleo diet, basically, aren't you?
Yes. and most importantly, average of 6.5 miles every day, walking.
Because you walk to the station and back and walk to work
Just now,
and back.
yes, sweaty and patchy, yeah. Yes. Yeah, I was reluctant to take the taxi. I said, no taxi, I'm going to make it by half.
Did you get here before the heavens opened?
Yes, I did, luckily.
Oh, well
yeah.
done you. I'm thrilled you're doing really, really well.
Thank you.
Okay, good for
very
you.
hard on it. I have
Huge
really
lifestyle change.
I have taken your advice very seriously and I have worked very hard.
Do you feel
on it.
better?
Yes, a lot. Yes, I am a lot better. Thank you. Thanks to you.
Oh, you're welcome. Well done you there. You're amazing. I'm really pleased. Okay, all right, take care of yourself. Bye-bye.
I'm Dr. Donald. How are you? Hello, Fires. You've got 2 spoons, and they're different sizes. So how is Fires?
Oh, he's really, the poorly feeling.
Oh, since when?
Nah, from day before yesterday.
Well, how did it start?
The sneezing and a sore throat.
Okay.
Yeah, coughing.
Thank you. Thank you for... Oh! Ooh. Hey. So he started sneezing, coughing.
Coughing, yes.
Now, if we take him out of that and we can examine his ear.
They really like it.
I know.
Coming out.
He prefers to be there. That's good. Sorry, I know. Right around the other side. I know, sorry about this. I know. Yes, okay. Nobody smokes. He doesn't live with anybody who smokes.
I am a husband.
Does he okay? You need to get him to stop smoking.
Sorry?
You need to get him to stop smoking. Smoking makes children get 3 times more infections in their ears, nose, throat and chest. Even if your husband always smokes outside the house. Smokes inside the house, it's worse. But smoking just exacerbates infections and can make the child more likely to get infections. It's a common misconception amongst parents that they think if they don't smoke in the house, that the child won't suffer. That's just wrong, wrong, wrong. The products of smoking are on the clothes and on the breath of the smoker. And children are a lot more vulnerable to the effects of passive smoking. The effects are extremely serious. Asthma is much more common. Ear, nose and throat infections. You're more likely to develop conditions like bronchiolitis or pneumonia. And cot death is about 30% more likely in the first year. He's got quite a sore throat, quite a big red, swollen sore throat, and that's why he's not wanting to eat or drink much. In his airways, he has some secretions, but the lungs themselves are fine. So this is really just about his throat. I'm going to give him some medication for a week. I think that will see it off. Now, we have a stop smoking service for Dad, so if you can try and influence him, and they can get really help, and also help with medication or nicotine replacement to help him stop. So it's really worthwhile. I know, he has to want to, yeah. That's what you've got to persuade him, yeah. So 5 mils twice a day for a week. He's going to be like this for the next 3 days. Yeah, good. You're very welcome. Yeah, not at all. You're welcome. And hopefully Fies will settle down. So I think he will.
What's your New Year's resolution?
Oh, I don't make New Year's resolutions.
Because you was breaking that then.
So, like, years ago when I wanted to give up smoking, I gave myself a date and said that's when I'm going to do it.
Right.
And I did.
Mine's to join the gym.
Is it?
Yeah, I'm going to get well fit.
Take a seat.
Well, I went and had one of them Blue Cross medical things, I don't know if you know about it.
Wow, so you got a thesis written about you. So this is your blood result, was it?
One part on there said I've got a heart of a 90-year-old.
Got a heart of a 90-year-old.
Also, that I'm grossly overweight. And I know I'm overweight.
So all good news then?
This is the one, the classic, very overweight.
Yep.
My weight is 13 stone 4 pounds. I wouldn't call that grossly overweight, would you? Really?
So it depends what your BMI is. So your BMI is just over 30, which is overweight. It's actually in the obese category.
Really sorry, it's no smoking. And do you cough much, Maureen?
I do, because I do smoke, I must admit, but
You're still
I only
smoking?
smoke about 15 a day. I'm really pleased about that.
And how much are you smoking at the moment?
It's no more, no less. You know, 8, 10 a day. I'm really interested in quitting.
Have you tried giving up before?
Yeah.
What happened?
Everyone bought me fags, I was going to kill everyone.
How many years have you smoked for?
Since I was 10. I have stopped before.
Yes, yeah.
I was off with 7, yeah.
So you stopped for a good 7 years and then something...
Got married.
You know, we always ask about smoking. Has that changed?
I haven't had a cigarette.
For how long?
3 years.
Okay, well done.
Helen Canavan, please. Oh. Hello, Helen. So you're here for your COPD review today? Right. Right, so how's things with your chest?
Yeah, all right. I've had no coughs or nothing. Really good since I've been on that.
Oh, right.
Very good.
So you're taking...
purple inhaler.
A little purple inhaler.
And a green capsule.
Good. Lovely. Absolutely fine. And do you smoke, Helen?
Yeah, I do.
How many are you smoking?
It's about 10 a day. But that's not, I've gone to roll-ups, so I don't smoke cigarettes.
Okay. And any thoughts of giving up?
No, not really. I'm not ready yet. I have cut down, though. Cut down an awful lot.
So how many grams is that, then, if it's roll-ups?
50 grams I smoke a week.
50 grams a week. So it works out at 10 cigarettes a day.
About 10 a day, yeah.
And you've tried giving up in the past?
No, never.
No.
Not interested in that.
You're not
Don't want to give up.
interested?
No, I enjoy it.
Even though you know it's affecting your chest?
Yes, but then it's not since I've been on that.
Feel better with the inhalers?
Yeah, a lot better. Got no coughs.
Well, if you did decide that you wanted to give up, we do have a smoking cessation clinic here. No, I know, I'm not saying you have to do it now. But if you did decide, you just book an appointment with her. She always has available appointments. So. All right. So coughing? Do you cough at all?
No, not at all.
No? No phlegm?
No.
What about breathlessness? Any problems there?
Just get hot flushes.
Do you normally get any chest infections in the winter?
I do, yes.
So we can't tempt you to have the flu vaccine to see if it might help with your winter chest infection.
Well, I don't like it. I've never had it done, so...
So, you've got your little purple and white inhaler.
Look at the state of it.
Gosh. And do you clean it out at all or
No,
not?
I didn't know you had to clean it out.
That's maybe why it's like that. Yeah, I'll give you another one of these, but you can wash them out. Goodness me, you've got half your medication in there.
I'm losing weight, I'll tell you that, because my belt, I've gone down, I've gone up one notch.
Yeah. Well, you need to continue doing that. And obviously, the best ways of doing that is through your diet and your lifestyle. If I'm being honest, I think what you need to focus on and what your take-home point from, I think, all of this is your weight.
Yeah.
Okay? Because you'll be surprised how much of an improvement on your overall health, losing some weight and bringing that BMI number down, your proportion of your weight to your height, bringing that number down will have on your overall sense of well-being, but also your risk of having things like heart attacks and strokes.
I don't drink. I mean, I do have a drink, but I never drink... Because I drive, I never drink two pints.
So I think what you need to do is focus on your exercise, because the rest of your checks were OK, but it did show that you are overweight. So losing weight and exercising, I think, is going to be the key here.
Well, as I said, I had cut my food down.
Yeah, but it's not just about proportions, but it's also about what you're eating as well, and also exercising, so going for walks. It doesn't have to mean...
I can't walk very far, I've got arthritis, both my knees and both my ankles.
It doesn't stop you swimming. I mean, where there's a will, there's a way with these things, and I think it's easy to blame lack of exercise on arthritis, but there are ways around it of low-impact exercises that won't involve you running or putting a lot of stress through your joints that will still be good for your heart. But the take-home message from today, I think, is that you need to work on your weight.
When I started doing sit-ups and touch my toes and for 5 or 10 minutes in the morning, that sort of thing. And, but I mean, I stopped it for a while.
Yeah. Well, I think you need to get back on with that. Yeah. OK, so yeah, I think exercising will help. All right, then. We'll see you in about a month.
I have to sit down because I keep losing my trousers. You keep losing your trousers? You're losing weight then? Yeah, look. That's good. I wish I was so good. It's not coming off in the right places. I think it's on my legs and... Mine always comes off my legs and my bum. Lastly will go on my boobs.
Yeah, I'm all over the place. Come and take a seat.
God, I've been walking, brushing on my feet.
Oh, that's good.
Whew.
How you doing?
I'm not too bad,
Yeah, good.
considering.
Considering what, advanced years? No, you're doing well. I mean, it's hard to believe, when I look at you, you're meant to be 59.
Yeah, I'll be 60 in 4 months' time.
Yeah, exactly. So you look about 30.
Oh, thank you very much. I'll say that to my husband.
Yeah, tell him. He must be keeping you young somehow.
You send me a letter.
Oh, to come in for your rooms. Yeah. So how are things going along that line?
It's been all right. Only I got some pain sometimes in my finger, pain and needle, and in my knee because I going up and down the stairs.
Yeah. Although I think your last lot of bloods were pretty good, weren't they?
Yeah, I had it. Was it last week or the week before, I think?
Yeah, so, for instance, when you look at your inflammatory markers, if your rheumatoid was really playing up, you'd expect it to be going through the roof. But actually, it's not. It's really low.
Even my blood pressure, it's down now.
Yeah, it's really good. Yeah.
She said to me, it's very good. I said, yeah, because I'm stress-free now.
It's stress-free. Why is that?
No, because I used to do a team leading job.
Yeah.
I was too much, so I just give up.
You gave up? We're seeing more and more patients who are more and more stressed. We can suffer from tremor, sweating, palpitations, stomach cramps, anger and irritability. So what are you doing now instead?
I just do the normal cleaning.
Normal? Okay.
Normal cleaning.
And not in charge of anybody else?
No. Just do what I have to do and go home.
What a nice idea.
I stress somebody else.
Yeah, you...
Somebody else take that stress.
Oh, my goodness me. People can help their friends or colleagues who are under stress just by being there. I think having support or a support network is really essential in today's life. Being able to talk to somebody about their problems and the things that are causing them stress is really essential. Thank you for coming in.
That's okay. So I don't know when you're going to see me, probably after my 60.
Yes. What are you doing for it?
I'm going to Seychelles to celebrate it.
Are you?
Yeah, most of the family is over there. So we just went to celebrate.
Excellent.
Yeah.
You enjoy yourself?
Yeah, my sister's coming as well, so my nephew. They live over here coming with me, so that would be... Yeah.
Good on you.
Thank you very much.
Good to see you. Take care. Well done. Bye. How are you?
The severity of the dizziness
Yeah.
has gone, the severity is a lot less.
Good. It reduced.
Yeah.
Good.
But I ended up on the floor the other night,
Yeah. And you didn't injure yourself then?
Fell on my side.
Did you? Okay.
Fell on the side.
Okay. And did you have a bruise or a cut or anything there? No. And did you think about having this manoeuvre I was describing done to send the dizziness away completely, or do you think it's settling by itself?
Would it send it away completely?
Well, that's the idea. There's no guarantees.
Yeah,
no guarantees with this, but we could do it.
I'd rather have the manoeuvre
Yeah.
and not take more tablets.
Would you? Okay,
Yeah.
okay. So I'm quite happy to do it. Do you think you'll be comfortable lying flat?
Yeah, once I'm flat, back might twinge through.
A little, yeah. So that's what we'll do, and we'll see how you get on.
Sorry, I'm just doing my exercises.
My old dear, she's thinking of getting an exercise machine. Now, is the exercise machine any good for me? Yeah.
Exercise is good for everyone, including
the old checkup, will it?
Do you do any exercise?
Not an awful lot.
Yeah, what work do you do?
Admin.
Okay.
Do you do any regular exercise?
Fishing season starts this week, so I can carry a big bag and I can walk up to 3 or 4 miles in a day.
Yeah.
So, I have to go to the gym or anything.
How are you doing with the gym and everything?
Yeah, not too bad.
I need to get back into shape. After having a baby, it is so hard.
Do you know walking football?
No, I've not.
No? It is what it says it is. It's for more mature people. Old gits like me.
So I'm going to keep you in this position now for about 30 seconds or so. Have you ever been to a physiotherapist to get back exercises?
They wouldn't do it because of the pain it was causing me.
Oh, really? Well, the way of getting rid of your back pain is through some exercises, which you need to do on a daily basis.
Yeah.
They say that exercise is the best anti-inflammatory. If you're doing exercises on a regular basis, you'll have less back pain.
So if I had a puppy to walk every day...
Take no notice, he's not having a puppy.
Oh, that's a bit cruel.
Yeah, but if I get a doctor's note, so I need it.
Yes, this is what we call social prescribing.
Yeah.
If I prescribe a puppy, then a puppy...
He lives with you.
Only a small puppy, much.
Good. OK, so bring yourself right round again. Good.
Onto my back.
Yeah, just as you were. Just reverse it at your own speed. Well done. That's right. Good. Up you come. Nice and slowly. Well done.
Right.
Well done.
What's the matter? You gone dizzy?
Yeah, that's what you can often find. But
That's as much exercise I do in a week.
well, I'd like to see you do more. I think that would. Yeah, I think it would be really helpful. I must say that puppy is sounding more attractive.
Dr. O'Donnell, come on now. He can't bend over to do his shoes up. How's he going to bend over to look after a puppy?
Usually, when people get pets, they become more active. Quite a lot of evidence about the health benefits of having pets. I'm just thinking about you and what would be for your health benefit.
Yeah.
So, a dog you can manage.
Only a little
Yeah.
Jack Russell, you know.
A nice friendly dog that you can manage.
As long as I can train it to sit up at the
Yeah,
wise.
good. Wait for about a week until you see the full effects of this. Well done. You did much better than I thought you would do.
Thank you.
Hi.
Hi, I've got an appointment with a doctor.
I can't believe you just put that drink there. I really want a Coca-Cola right now. I'm gonna have to ask my partner to bring me one.
Mr. Marek Malek? Hello.
Hello.
Thanks for waiting. My name is Dr.
Hello.
Bajwala. How can I help you, Mr. Malek?
Yes, I've been here last month.
Yes.
With some other doctor. I'm drinking too much.
Yes.
Yeah. And I actually can't go to the work, nothing.
When you say you have a drink problem, what do you mean by that?
I'm drinking every day.
All right, so how much do you drink?
Whoa.
How do you quantify your drink?
I'm drinking a cider.
Yes.
Yes. You know the big bottle. I don't know
Yes,
if you
3
know.
liter, 3 liter.
3 liter one, 7.5%.
Yes.
So it's like 1.5 a day.
Yes.
I'm not getting myself drunk. I'm just, I just have to drink it.
Yeah, if you don't drink, what happens?
I got headache,
Shaking
hands. I'm vomiting in the morning with the phlegm and everything.
So how long you been drinking this heavy?
This is
too much.
This is not heavy. I was drinking heavier.
Do you drink any alcohol at all?
Today?
No, anytime.
Anytime. Sometimes, yes, beer.
Alcohol, do you drink any?
Yeah.
Yeah? How much in a week? Be honest.
How much were you drinking, alcohol-wise?
Probably 4 tins, 4 pints a day, maybe.
It's quite a bit, isn't it?
Yeah.
Were you doing that every day?
Most days.
Yeah, okay.
So how much would you normally drink when you're out?
3 beers and a couple of wines, 2 or 3 wines.
For a party, maybe.
So how many parties have you been to?
Here, no, not too much. But before.
Yeah. So not every day? Okay.
I've had for lunch today.
Right, okay.
A beer and 2 wines.
Okay. How many parties last year? 1, 5, 10?
1, 2.
Okay. That's fine.
I can see that you have definitely got alcohol problem. You're drinking way excessively than what you should be, because you're saying that you're drinking mainly just to feel normal. Yeah? If you don't drink, you will have aches, and most likely you might end up having a fits which can kill you.
Yeah.
How about the money? How are you doing financially if you're not working?
She's working. I'm taking money from her.
All right.
The thing is, I've been supplying it for so long now, and the thing is, in my head now, if I don't give him the money, he's going to end up in hospital again.
Yes, I can understand.
And
Yes.
it's getting really bad.
And what you need to do is obviously to get into alcohol service again. You need to get detoxed. Once you get detoxed, you engage yourself into AA, Alcohol Anonymous. I will obviously write to them as well, but they expect the patient to come by themselves. Then they know that the patient actually wants to do it. If he doesn't go, you let us know. You come back here. Yeah? Sure?
Yeah, I will.
We know that the people who are drinking alcohol, they don't eat very well, and that's why we prescribe vitamins. Yeah? So I'll do a prescription for that.
Okay.
You need to have a blood test, especially with your liver function. Yeah? Okay. All right.
Maybe I'm gonna
Okay,
eat
thank
that
you.
today.
Yeah?
Thank you very much.
Okay then.
Thank
Bye.
you. Bye-bye.
I understand you have a smoking nurse here?
Yes, we do.
Could I book an appointment to see her?
Okay.
They've put £1.20 on a packet of cigarettes. That now makes it over £7 a day. That I thought, no, Kev, I'm sorry, mate, you're a fool. You've got to stop this.
Yeah, I know. Yeah.
You know what it's doing to your health. You know
Yes, yeah,
it's
that's
just
true.
ridiculous, my love. It's silly.
Yeah. That's a good decision.
I just don't want to think about smoking at the moment. Thank you, that's
Take
special. So
care,
that's
sir.
this Wednesday.
This Wednesday, 10:45. You know, we'll see you.
Thank you
Okay?
very much.
Okay, bye-bye.
How are you today?
I come in last Wednesday. My throat was really sore.
Yes.
And closing up. The swelling's gone a bit, but the infection, everything's still there.
Yeah.
I've got a lot of burning all down here. I'm really achy and struggling to eat. I'm gargling salt water every hour.
Yes.
And it is just...
When did this all start, John?
Just over a week ago Sunday.
Bro, any cough?
Yes, the cough. The cough's just been because I've got a normal sort of smoker's cough. I'm not a heavy smoker.
Okay.
I'm in the process of trying to wean myself off.
Good.
The cough has been getting worse. I'm bringing a bit more stuff up.
What colour's the mucus now?
There could be a little bit of green in it.
Any wheezing?
Yeah, a bit, but I have been diagnosed with asthma recently. Well, COPD, but she said at the moment it's more like an asthma.
Okay.
But I still walk, and I walk at a brisk pace. And when I was first diagnosed, I got a pedometer to see how far I was walking. I was doing 13 miles.
Wow, okay, a day?
A day.
Very good. That's better than me.
I do overtake some joggers.
I'd probably be the person you'd be overtaking, to be honest with you.
Even though I
in
smoke...
terms of the smoking, how much do you smoke?
I mean, I reckon at the maximum, it's about 7 or 8 a day.
Have you had help from our smoking cessation clinic? So getting help from the smoking cessation clinic has proven to be far more effective than trying to do it by yourself. Yeah. And with your history of COPD, with the lung disorder, is massively important.
I know, it comes to a point in your life where you just realise you can't do it anymore.
Good man. But it sounds like you're absolutely on the right track, Jonathan. So you want to change, which is the biggest hurdle, which is good. So just pop your finger in there for me. Stopping smoking is one of the best things a person can do to improve their health. After a person stops smoking, within 3 days, they can feel their breathing becomes easier. From weeks to months after stopping smoking, they'll have more energy, you'll feel less tired, there's improved fertility and sexual function. After a year, the risk of heart disease is half that of a person who's continuing to smoke.
Sorry.
That's okay.
See, it's just like that. It's dirty little bits. And...
Okay, grab a seat for me. Okay, Jonathan, we definitely need to continue your antibiotics. You only had 7 days of those antibiotics, usually for the course. It's a 10-day course. Glad you came in. Let's get it better.
Okay, thank
All right,
you very
no trouble.
much,
Lovely to
Doctor.
meet you, Jonathan.
One sugar for me, Ryan. I've cut down. Dr. Nanda told me I was diabetic waiting to happen, so it'll just... Thank you, you're a star, yeah. Thank you.
Hi, Amrit. Come in. Come and take a seat. Your mum, yeah?
Yes.
Okay, and this is Amrit. Yes. How can I help?
Now, Amrit started off by having like a few little pimples on the side of his head.
Oh, yeah.
But it's actually then it got septic and the burst and then become blotches.
Okay. So when did this start?
In about a week.
Okay, so did it start with one pimple or?
Yes. It started with this one.
Okay.
And then, can you see how it spread? And there's some hair. Now it's getting really it started scabby.
Okay.
And it started there. It sort of gets a bit sore in the evening and on this side.
Yeah.
So where
Are
it's
they
like,
itchy? Yeah. They're itching?
And I can see
And
actually
they're
it's
yellow
going
too.
on. It's
Is there
going.
yellow pus coming out?
Yeah.
Like, is it clear or yellow, Mum? Have you seen?
And it's coming on this side as well, if you can have it.
Yeah, I'll pop a pair of gloves and we'll have a feel now.
It's itching.
Yeah, it's itching. Has anyone else in the house got a rash at the moment? And do we know what caused this? Did you remember being bitten by an insect? Anything at all? Okay.
She thought it was asthma, and she showed me extra things like it could go all over your body.
I mean, if we left it, it potentially could go to bigger parts of your scalp. So
we need to, and I googled it. So
Yeah.
I was saying to him, we must cut out your sugar. But he does eat a lot of chocolate.
Do you? So do you have a lot of sugar? On average, kids in the UK are consuming 3 times more sugar than they should be doing. Sugar can cause dangerous unseen fat deposits in children's bodies, especially around the vital organs. And this can start at a very young age. So we do encourage parents to cut back on a children's sugar intake.
I love sugar.
So I said to him, you need to stop that.
Yeah, I'm addicted to sugar as well. I've seen a rash similar to this, actually.
Okay.
It tends to be bacterial. So the normal bacteria in our skin is called Staph aureus, and that produces that clear yellow kind of pus. So have a look at this.
It's like a number of allergies and things that are going within. But can you see where it's like now spreading?
Yes. Normally, we would give a topical or an oral, basically antibiotic. I think because this is actually spreading, we're going to have to go for the oral antibiotic or flucloxacillin. Is he allergic to anything at all? Penicillin, anything?
No,
He's had amoxicillin.
Yeah, he's had that.
With the creams and things, try to leave it dry. But if it's itching, obviously don't try to put any oils or things on it. So what are these toys you've got?
These are from the Kinder eggs, but I don't eat them anymore.
Because they've got a lot of sugar.
I've got only these 3. They're from the cartoons.
Really? That's the antibiotic. 1 spoon 4 times a day.
Okay, lovely, thank you.
All right then, nice to meet you. Take care. Oh, don't forget your green one.
Come on, you. Such a cheeky. Oh, God, you're such a rascal.
How are you? Just take a seat. Hi, how are you?
Jacqueline.
Hello. Very good. Nice to see you.
And you.
Good. So, what can I do for you today?
I believe we're here for results of blood tests.
Results. Okay, so let's just have a look. You had a kidney function test done on Friday, and that was very good. But your sodium is low. Sodium is something that's in your blood. Sodium chloride is salt. This is probably the lowest it's been at 126.
My dad does drink alcohol. Would that be a cause?
It could, yeah. What do you drink? Is it beer you drink? Yeah.
Week longer.
Yeah, And how much of it would you drink in a day?
It used to be about 6 when I was watching the football. But
Yeah.
the last week or so, it's been maybe just 2 or 3.
2 or 3. And is that what it's like normally, 2 or 3 a day?
No, it used to be twice that.
Twice that, 6, yeah. Well, I mean, low-risk drinking would be something like a maximum of 1.5 pints a day. So it probably would be a good thing to cut it down, not just from 6 to 3, but from 3 to 1.5.
I don't believe that it's only for 2 or 3 some days. That's my opinion.
What do you believe is the average?
I think that he probably drinks between 3 and 6, depending on the day and who he's had round or what he's been doing.
Yeah.
And my dad has drunk for a long time. I can't just tell him to stop.
No, and I wouldn't have him stop. I wouldn't have him stop. It's just that drinking more really than 1.5 pints in a day is going to expose you to risks in terms of your liver, your stomach, and killing liver and brain cells. So it's good to just be a low-risk drinker and manage your risks.
Not trying to be a smart ass, but I've always known the risks.
Yeah. It's up to you to decide what level of risk you're happy with. But the snag is, as you get older, those risks turn into reality. And that's the problem. Then the chance of them happening climbs up to, 70, 80, 90%. I mean, that's nearly a guarantee that they're going to happen. Now, not all of them, but none of them. So it would just make sense to sensibly cut down as much as you can. If you need help with that, there is help available. So that's a urine test and a blood test. If you could make an appointment.
Next week?
Yeah, about a week's time.
Brilliant.
See. Good.
Thank you
nice to
so
see you,
much.
yes.
Have a lovely day.
Yeah, and you.
Take care.
Bye.
There you go. Go steady. See you.
Yes, bye now.
About you, Kearney.
What?
Any New Year's resolution?
I'm gonna drive.
You're gonna drive?
That's a good one.
Yeah, that is a good one, because that's...
By April, I'll be driving.
That's achievable.
Yeah, that is.
Not like me.
No, neither. I failed my test 3 times before I passed.
Oh my God, I've got mine booked for the 7th. February the 7th, mine's booked.
What, your driving test?
Yeah.
Oh my God.
I'm proper scared. Yeah, I'm proper scared.
How are you coping with everything?
Oh, the legs are killing me.
They are swollen, aren't they? Like a little, on the feet, yeah.
And then when I wake up in the morning, they're still swollen.
On the left side?
Same. Nothing won't move. My whole body doesn't want to move. Then see, it's sore when you press that.
Yeah.
Everything feels sore on the back. When I lay down to go to sleep, and I'm like literally at rest.
Okay.
The back of my shin hurts. I've got a chair that can pick my legs up, and that kills me because the back again is touching.
And you've got very dry skin. Are you applying any creams at all?
I can't do it, can I? I can't reach because I'm arthritic up here. I can't do anything. Nothing at all.
So there are many reasons why people end up with swelling in the legs. One of the main reasons is any internal system failure like liver failure or kidney failure.
Or heart failure.
Heart failure. So obesity itself, you'll have circulation, sluggish circulation. And for that, we tend to advise Of course, leg elevation and stockings and everything to help.
Anything just to stop this.
That's right.
Heaviness.
Have you ever been tried on stockings at all?
Never.
Never. To try that and see whether that would help with your leg swelling.
I'm always out of breath. You know, I get as far as my door to open it to somebody.
Yeah.
And I feel like I've run a marathon.
I don't eat a lot of rubbish. I eat this English roast beef Yorkshire pudding and steak pie.
What food are you making at home? Which kind of thing?
If you know about the Asian food, the roti and salan.
And how many rotis are you having?
No more than 1.5.
I do like about lunchtime about 3 digestive biscuits and a couple of choc biscuits. Not chocolate biscuits, but with chocolate in them.
Okay.
With a Kit Kat.
I thought, oh, I fancy a pasty.
Okay.
I took it home, I put it in the microwave and had some chips.
What sort of bread do you eat? White bread or?
Yeah, white bread.
Okay, so you need to stop the white bread and eat brown bread instead.
Right. I would steer clear of sugar.
From 3 sugars in my tea, I'm only having 1 now.
Well, 1 is better than 3.
I just like sweet things, so...
Well, don't we all? I love sweet things.
I finally get you in the room.
You want to take some blood this morning?
No blood. We done it already, didn't we? So I'm just going to check your blood pressure and then I'll just make sure you're all right.
My sugar's not back yet.
They're back. They're better than what they were, but they're still a little bit high. Do you drink any alcohol?
No.
Smoke?
No.
Are you sure?
Yes.
I'm joking. And in terms of dietary, how are you doing?
I think I eat a lot of bad things because I send the children out every other day to get me a sponge cake, jam sponge cake, which is not good for my diabetic.
Yeah, all the sugar in that and the jam. Okay, so we need to stop with the sponge cakes. Is it a whole sponge cake you're eating or just a slice?
Just a slice.
Every day?
Yeah.
Oh gosh, no. No. Right. And then what about carbohydrates?
I eat rice.
Yeah. A lot of rice?
No, a lot.
No. Okay.
Rice.
And fruits? Do you eat a lot of fruits, vegetables?
No, I don't eat a lot of fruit. I eat a lot of mangoes.
Yeah?
I would eat 2, 3 mangoes a day, sit down and eat 2, 3 mangoes.
All in one go?
Yes.
Oh my word. Right, so mangoes, fruits are fine.
Yeah.
But too much fruit in one go, again, a lot of sugar, because fruits contain a lot of sugar. Yeah? So try to space it out. Any questions? Any worries? Any concerns?
Yeah, I want to... Some days I'm feeling up, some days I'm feeling
a bit down. Yeah. Is it lifestyle, or do you do things at home? You know, do you have any hobbies or anything like that?
I was to go to the gym, but I stopped now.
Go to the gym?
Yeah.
Wow. Okay, go. Join back on there, because exercise helps. Yeah. It really helps. When you're feeling low, it helps. The body releases things that it needs to get rid of. No, don't sprint on the treadmill. But no, exercise is really good. But yeah, I mean, if you're feeling really down and it's getting to the point where you feel like you need to speak to someone, that's why we're here. Yeah? And I'm always about as well. I can always help.
Yeah.
Lovely. All right, good to see you. Let me get the door. Take care. All right, bye-bye now.
I eat and I feel like I'm full up with every little meal I have. I mean, I eat in the morning about 8.
Have you thought about bariatric surgery?
I'm telling you what, you give me that with it today. Send me now. I'd have anything. Do you know what I'd like? To be like her again. Because doctor, for years I was a dancer, a singer on stage. I was always slim.
It's worthwhile touch basing that if you're interested.
I am.
I can see
100%. I just want to be me again and be able to walk up the street.
Yeah. Realistically, we need to look at that now.
Brilliant.
Bariatric surgery has had its fair share of controversies. When patients are obese, there's a perception it's a self-inflicted condition. What one needs to remember is, although the bariatric surgery costs money in terms of thousands of pounds, for example, a gastric bypass can cost up to £8,000, it reduces all the multiple long-term complications, which would take much more from the NHS in terms of the spend.
Is that okay?
Yeah, that's 100%.
Let's do it.
You're a darling. Lovely. You're an angel.
All the best. Good to see you today.
It's good to see you too. You don't look a day older.
Day older.
But I'm 2 stone heavier.
All right.
So that's my older, isn't it?
Yeah.
Thank you, doctor.
All the best. Take care.
What do you want? Coffee. I don't drink caffeine full stop now.
Oh, now you have your own tea bags.
I gave it up, I did. It's hard work.
Do you not miss it?
No.
Really?
No. It's been easily 9 months.
Wow. Good girl.
Bruno Bassano. Hello.
Hello. I never see you.
Come in and take us. Oh, well, I've been here 9 years.
I know. I'm sorry. I'm registered with you now.
No, you registered with Dr. Bolger.
She goes like, she's very good. She's tough as a cookie. You're tough
Well, it.
I lost 1.5 stone. I've been in very well for the last 4 or 5 months. My cholesterol got down as well. My blood pressure's got down. My feet is fine.
The only thing that isn't fine is your diabetes.
Well, I have to work on it.
Really not good. It's got worse.
Is it? What else I should do?
Well, that's the question. Do you have a sweet tooth? Do you eat lots of sweets?
Sometimes, yeah, Yorkie, that's all I eat. Well, I eat 1 bar of chocolate Yorkie almost every day. I like that.
Okay.
I'm a sucker for that.
Right. Once a week.
Not every day.
Not every day.
Yeah, okay, then, because I go to work and I don't eat because I'm a bus driver. I work in the airport and I don't eat at all, especially in the afternoon, when it's afternoon shift. Sometimes I just take 1 Yorkie bar and a couple of bottles of water. That's all I do. I don't eat nothing. I think that's could make my diabetes go up. Chocolate?
Chocolate is terrible stuff for people who have diabetes. Yeah.
I have to.
The problem with chocolate is it's not only has it got sugar in it, it's got lots of fat in it as well.
Yeah.
So on both counts, it's really not good. And the fat slows the sugar release, which is not good either.
Sometimes I'm going to not put my hands on the fire. Now and again, I have a pint of lager.
That is allowed.
Oh, bloody hell.
Life's too short not to have a pint of lager.
But the chocolate, I do eat it.
Yeah, the chocolate we have to stop.
Okay.
And what we'll do is we'll check you again in 3 months' time and see how you're doing.
Yeah, no, I will cut that down.
Okay, science.
Dr. Holland,
All right,
nice to see you.
take
Nice
care.
lady. I'll come to
Bye-bye.
you next time.
All right. Bye, Mr. Bassano. I shall tell Dr. Bolger it's easier to see the Pope. Oh, dear.
Thank you. See you around. Thank you. So for my New Year's resolution, I've decided I'm going to try and get some more sleep.
Nice to see you. Yeah.
Thank you, thank you.
Yeah, you take care, Mr. Said. Yeah. Bye now. I make resolutions all the time, so I don't wait for January the 1st. So I probably have about 150 or 200 resolutions every year.
Cheers.
Nice to see you. Cheers, bye-bye. I need to look at having a much healthier diet in 2017.
Take care. Good luck with everything.
Thank you.
Bye. My own New Year's resolution is to definitely cut back on my sugar intake and to maintain my regular daily exercise.
Bye-bye. We're friends now, excellent.
My New Year's resolution is to focus more on my sports and exercise, especially football, so hopefully one day I can sign for Liverpool Football Club.
All right then.
Better safe than sorry.
Okay then, don't forget your Skittles, unless you're leaving them for me.
This year, I want to ensure that my life is full of more singing, more fun, and more laughter.
I have been experiencing some nipple tenderness.
If you feel pushing, that's fine, right? If it's sharp, then tell me. Can you feel any of that?
I've started like cutting and stuff like that again.
And do you find the cutting's a bit of a release for you?
It does, but I mean, I used to work at the ambulance service, so I know it doesn't help.
running.
Must be very keen.
Come on in and have a seat. How are you doing?
Not so bad, thank you.
That's a grand one. Just give me a cough.
Just need something just to calm me down.
Right, okay.
It's like I'm just going crazy.
It's a really funny smell as well, like blurred and a little bit of pus. Okay, from here, yeah? Yeah.
Every so often, it's not every week, but every so often I just black out.
Look at yourself and go, do you want to live longer? Yeah? It's as simple as that, really. You need to confront it, but fundamentally it's...
In fact, that's even more dangerous to inject around that tendon, because if that degenerates the tendon and it snaps, you don't walk anymore, and I get thrown off the register.
Good morning, Final Row Surgery. Margaret speaking. How can I help?
What are we doing for you today?
I'm just fed up with everything, to be honest.
Dear, why is that?
I'm taking about 6 Laxodol a day.
Yeah.
For my constipation. But as you can see,
You're a bit bloated, aren't you?
it's like this.
Dear.
It'll ease, and then
Yeah.
the next day I'm back in the same position.
Let me just pop you up here to feel your tummy.
Yeah.
Because we might have to give you something extra to try and get you going. Because they're obviously a bit sluggish, your bowels.
Oh yeah, the doctor said with all the scars, because I've had 4 operations, in and out.
That's not any help.
And he said the scarring doesn't help.
No, exactly. The sort of scarring tends to sort of close over the bowels and doesn't allow them to sort of... Well, that's a grand one.
Yeah.
You've a nice big hernia there, haven't you?
I got another hernia here as well, which is popping out more often as well.
Right. Could you just undo this a minute?
I'm fit as a fiddle.
Could you just undo the belt and let me just have a little feel down here? Just give me a cough. Oh yeah, you can see that. That's
Got that one. I got a little lump on my testicle as well.
Oh, have you? You're full of things today.
Yeah, while I remember.
Right side, okay.
That side, yeah.
Okay. Let me just have a little feel. That's okay.
Well, not a lump, it just looks like it's... If you can...
Yeah, I know you can. That's called your epididymis. It's supposed to be there. I think
that's right then.
Tiny little system there, that's fine.
It doesn't hurt or anything.
No, that's good. There's nothing else to feel. But...
No.
Let me come, mate.
How you doing?
I'm all right. Come and take a seat. Right, what am I doing for you today?
I speak to Dr. Hedder and Dr. Lee. We forward with you because my pain is mine.
In your foot?
Yes, yeah. And yeah.
Okay. So this is all related to your Achilles tendon coming into your calcaneum. Okay, let's take this off.
Okay. They say Dr. Ward gives you a steroid injection.
Dr. Ward will not inject that.
I don't know.
There's a different thing under here, which sometimes I used to inject, but these days we've decided it's more dangerous because you can snap tendons after doing it.
All right.
And actually, it does nothing for anything up here.
Yeah.
Okay, so this,
Yeah.
so here is your calf muscle, comes down, calf muscles, there's a number of them.
Okay.
They turn into your big Achilles tendon, okay, which is here, and that's all right.
Okay.
And then it inserts into that bit of the heel where it's sore. That's it. So it's a tendonitis as it goes into there, and I should imagine that stretches it up, but does that hurt it when you do that?
Yeah.
Yeah, okay. You need progressive physiotherapy to try and help that, okay?
All right.
So pop that back on. Put your sock on. So you don't need an injection from me, you need some physio because there is specific physio for tendons, okay? And it involves some strange things where you're literally stretching that tendon up while standing on some stairs and dropping your heel below the size of the stairs and doing that over and over again and then putting a backpack full of bricks on and doing it as well to try and do that. So that's what I need to do for you, mate.
All right.
There's nothing to inject there. In fact, that's even more dangerous to inject around that tendon because if that degenerates the tendon and it snaps, then A, you don't walk anymore, and B, I get thrown off the register.
No, I don't want to do that.
So that's important, but it's an Achilles tendonitis. I'm going to write a referral to the physios, yeah?
Okay, thank you, Dr.
Good to see you, mate. Bye-bye. Do them up, and then what I'm going to do, I'm going to give you something that you sort of have to put up the tail end.
Yeah, that's fine.
To try and make sure that things start to go from that end.
Yeah.
So as well as tackling it from above, we'll tackle it from below.
Yeah.
Now, for the laxative...
When I do go, it is quite loose.
Yeah.
It's not a case of being
just getting a bit stuck, isn't it?
But it's getting stuck up in there.
Yeah. Are you drinking plenty of fluids to make them...
I drink...
Okay. Because if you don't, then the Laxidol and the Fibogel don't work as well if you don't sort of use them.
Yeah.
Okay.
And I have about 20 cups of tea a day.
Yeah. Okay. Now, it's little sort of mini enemas that you just stick up the back.
Yeah, I've had them before.
Fine. So what I would suggest is one in the morning, one at night to make sure you're going. Once you're going, then we'll get things sorted then. Okay.
That's great, yeah.
Then once it's settled, just use them intermittently when you need to, and keep using your Laxidol and using your Fibogel in between times.
Yeah.
Okay.
Yeah, because I eat all, prunes and,
I think when you've a problem like constipation, you do everything you can, because it does make you feel unwell for such a sort of simple medical problem to go wrong, but it's a huge effect.
It just gets me down.
Yeah.
Okay then.
Okay?
Yeah.
Right?
Yeah.
Look after yourself.
Yeah, thank you.
Take care. Bye-bye.
Bye.
My sister, she just had a little baby, bless her.
Oh, how lovely. What did she have?
She had a little boy, and I was her birthing partner.
Oh, excellent.
I was, and it was very...
It's amazing, isn't it?
It is amazing, but I probably saw too much of what I should have seen.
Come through. Okay, how can I help?
So for the past couple of days, I've had like horrendous back pain. And I get the fact that I'm pregnant, but it's like really sharp, like in my back. There's so much pressure down here as well. But it's my upper back as well, like, and I'm being sick.
Last month you were given some antibiotics for urine infection, is that right?
Yeah, I went to the walking centre and
Yeah.
they said that it could have been like a kidney infection.
Is this your first ever pregnancy?
Yeah.
It does affect different women in different ways, and it's really hard to compare. You're quite tall, so some would argue, you've got the stature to hopefully absorb the increasing size, but that doesn't always fit. Your hips are being pushed because of the baby getting bigger. That can cause trouble for some women, so it's difficult to say. Now, can I examine you, if that's all right? Yeah? I'll work around you here. So whereabouts does it hurt the most?
It's like here.
Okay, in this area. Can you pop on this couch? Just have a look at your tummy. And you feel your tummy's growing regularly?
Yeah.
If you sit up for me, and then if I just feel down your back again. Is there any pain here?
It's uncomfortable, yeah.
Right, so what I will do is ask you, if possible, to do a urine sample.
Yeah. I've just gone to the toilet and I've just wiped them and like bleeding.
Oh, it started raining?
Here?
Oh, yeah.
Looks like there's a bit more rain out there, doesn't it?
Well, yeah.
Your hands are cold.
Well, it's a cold day up there.
They feel a bit cold. Sometimes it can be triggered by cold weather, so whether that's had anything to do with it, I'm not sure.
Because I want to go on holiday.
Where are you planning to go?
Somewhere warm.
How have you been enjoying this weather?
Loving it.
Good, good.
Loving it.
Soaking up all the vitamin D.
I've just gone to the toilet and I've just wiped them and like bleeding.
Okay.
So,
Is it more than you've noticed before?
not really, like before I was bleeding a lot more heavy, but...
When you went to the hospital?
Just started bleeding
Okay.
now, so...
Right. I'm just going to dipstick your urine. Interestingly, it there's just a few spots of blood on here, but you've actually seen some blood on wiping. Okay. Do you mind getting back onto the couch so that I'll just listen to your baby? So how many weeks are you at the moment?
22.
Okay. So beating away, which is good. Brilliant. Okay. So that's reassuring.
Yeah.
But obviously, if things develop with the bleeding side and it's getting heavier, or or severe pain in your tummy, then I think we'll need to get you seen at the fetal assessment unit again. All right. If a pregnant woman sees blood in the urine, it is very important that they consult a clinician as soon as possible. Blood can be from a number of places in pregnancy, and obviously the priority is to make sure it's not from the womb itself. But if it's just in the urine, then it's important to make sure that there's no urine infection, or there are other causes that are increased during pregnancy, such as kidney stones. Having assessed you, I think there are a couple of things. You may well have your general aches from being pregnant, but it's very specific that you're tender on the right side, more or less in the loin. Now, I need to make sure, because the risk of urine infection is a bit higher in pregnancy, that although you had a test nearly 4 weeks ago and it was clear when we sent it to the lab, I'm planning to send this again. Did you have any antibiotics in the last few weeks?
I had cephalaxin.
Okay. It may not be a urine infection, but as a precaution, I can give you some more antibiotics. My temptation would be to give you like amoxicillin, which can be used in pregnancy. But for your pain, that's the slightly trickier issue. With the general aches and pains, the paracetamol is the favoured option. I think at this moment in time, let's focus on making sure you don't have an infection. Make sure baby's happy, and we've checked from the heart rates, things seem okay. But if you get any extra bleeding or severe pain, seek attention. But otherwise, if things are still like this and your urine comes back negative, then it probably will be related to your pelvic muscles, and you can get something called pelvic dysfunction with pregnancy, and that can be something that will develop. So physiotherapy may be needed, but we can talk about that later. All right? Okay, there's enough there. 3 times a day for 5 days. All right?
Thank you.
Take care. Bye-bye.
It'll be about 5-10 minutes for you, all right?
You're a big help, thank you very much.
You're more than welcome, sir.
There's always a warmth and a smile here with all the staff. They're all very good.
That's what we like to deliver.
Yeah, well.
Service with a smile.
Unless it's because I look the real aim, poor old stud. But I don't feel that at all.
No, not till you don't look it either. Have a lovely day, sir. Bye-bye.
There you go. Come in, come in. Can you squeeze through? Right. Now then, how did you get on with the acupuncture last time?
I mean, same pain is there.
So shall we give it another try and see if you get any relief with the acupuncture?
Yeah.
Do you want to slip that stuff off, and I'll just get some pins ready then, and we'll do both sides for you. Good. So pain. Let's see what we can do. Just relax for me here. I'm going to put one up in here. I've known Shahid for about 15 years, treating him with acupuncture for his pain in his arms. He's an ex-policeman who had a road traffic accident in the mid-80s, and as a result of that became paralysed and has only got limited movement of his arms and no movement in his legs. There you go.
Oh, my bad.
You want to do that? Yeah, no, you take it.
Hello? Who's speaking? Thank you. All right, thank you. Bye-bye. Bye.
Okay.
This was my wife's.
Yeah. Yes, it's not been good for you, has it, really? And that sort of having to look after her. Shahid's life has become even more difficult because not only is he paralysed, his wife had a stroke. As a result of that, she is also wheelchair-bound, and he has now become a carer, where she had cared for him previously. And are you coping with sort of looking after her, or is it just a bit of a big struggle and too much for you, or?
Yeah, it is too much struggle because although she's got the gears, but we don't have much of time. Time slots very less.
Mood-wise, do you feel okay? Are you bearing up sort of mentally, do you think? Because you're a strong chap, I know, but it puts a lot of pressure on you.
Yeah, because once I had a disability, so I didn't feel much because my wife was helping me and all that, so I could take it. But my wife, now I'm shattered because it is too much, both of us, and she can't even move.
And you need to get you and her both properly reassessed. And if there's anything we can do, obviously let us know. We'll try our best. So let's just get these out. Okay, that's it all done. You can get yourself dressed again. It'll feel a wee bit stiff, but hopefully then you'll get a little bit of relief. Particularly these ones will feel a bit stiff. Okay? But let's see how you get on, and then we'll get you in again. Now, I can book you in next week for the sort of the same time. Is that too early for you?
It is, because carer come, they come late as well.
Could you do 11:30 or 11:40?
Yeah. Hello? बंद नहीं कर रहा हूँ यहाँ से. She's quite worried, all the time. Because she rings me, because she's not. I don't know what to do. It's not easy.
It certainly isn't, and you have to look after yourself, and then trying to look after your wife is not difficult too. Are you looking after yourself now? Are you eating and stuff? Are you?
Yeah, not very well, because sometimes you have to prioritize things.
You do, but don't let it go so that you don't look after yourself. Phone, keys. Look after yourself, Shahid. Not at all. Take care. I think that's everything of yours. I'll open the door for you. You're welcome. Oops. Okay, take care then, Shahid. Bye-bye.
How's Litland? How's your son?
He's 3 1/4.
Never.
Yep, and he's at nursery.
Oh, I can't believe it. Seems 5 minutes since you had him. Alison used to be radiographer up at Wexham. Okay, so I'll just get... And you're sure you're happy for me to do it? Fab.
I'm sure you've seen thousands.
I've seen many. Okay, so, Alison, you're still having periods? Now we just need to do the nitty-gritty. Come behind the curtains, lovey. That's across your middle, OK? It's your modesty blanket. OK, you get yourself ready. Let me know when you're...
Everything or...
Just your knickers and your trousers, obviously, or take one leg out. So where are you working, Alison?
I have my own limited company.
Do you? How's that going?
This is my 9th week off.
Off?
Yep.
How come?
No agency work.
Oh, no.
Oh, yeah.
Oh, dear.
But yeah, they've offered me jobs in the Midlands, Southampton, Ireland.
Oh, gosh.
Leeds.
Yeah.
Everywhere but Slough.
OK, right, so I've got this. Right, Alison. Legs apart, love.
Every time I have to come here, I'm reminded of that joke.
Go on.
Where the mother...
I don't want to put this in while you're telling me a joke in case I laugh. Go on.
The mother, she was rushing to get out of the house and she picked up a cloth and, she just did a quick 1-2. And when it turns out she went to the, the GP to do whatever needed to be done, she said, was it OK? He said, yeah, but I like the fact that you've specially prepared yourself with glitter. She'd picked up a cloth that her daughter had been using and put glitter all over it.
Pretty.
She's just...
There's no glitter down here, love.
No, there isn't any glitter.
OK, right, this is my hand, OK? I've got a little bit of gel on the speculum. Right, I'm in, and I'm just going to open it a little bit because I'm looking for your cervix, which I can see. OK, bear with me. OK, it's pointing a bit down. I'm just going to get the sample. OK, I've finished. All done, lovey.
Okay.
Paper towel here.
Thank you.
That's OK. Fab, you are done and dusted, Alison. OK, you're welcome.
And I'd like to see you again.
Take care. All right, then. Hope the work picks up for you. Bye-bye. Bye.
Well, basically what happened yesterday at work, I had massive pain of my shoulder. I could not lift anything. I did have it dislocated, like twice, like badly. and it's like. Keep
So
on
what do you do
coming.
as your job?
I work in a warehouse.
Okay, so you're doing heavy lifting, or what are you lifting?
Plaster boards or some bags of something.
So have you ever had a fall on your shoulder, or you have? When did
Yeah.
this happen?
Like 4.
4 years ago. What did you do? Tell me what happened.
Well, I was on paintballing. It was it was
Paintballing?
wet. Yeah. Yeah.
And tell me what happened.
It was really, really wet. I was like running, and basically what I did, well, I sort of make a backflip, and I landed on my shoulder.
You have to be careful, don't you, Bartos? Okay, so that was 4 years ago. Show me which part of the shoulder it's hurting, or pop your tops up. So show me which part of your
So
shoulder is
basically that like hurts. Literally that around.
that area, okay. So what we need to do, I need to examine you, okay?
Yeah.
So let's start from the beginning. Okay, arms to the side as far as you can go. So that's very good. So show me which area, this area is
Yes,
hurting. Okay.
that's basically the area.
Let's have a feel. Okay, just go to the front. Let's have a feel. And finally, let's just check your neck. Just move to the left and right. Look up, look down. That's all fine. Yeah, that's brilliant. Okay, take a seat. So from examining you, Bartos, there's nothing nasty going on at the moment.
Yeah, I know, like...
Yeah, I don't think you've fractured it, but I think it could be a ligament problem. I think sometimes, like from the previous injuries you've had, the fact that you do a heavy lifting job, we have that a ball and socket joint is the shoulder joint, and there are these 5 small ligaments that go around it, and it allows you to move the shoulder quite well, but the problem is it can dislocate easily. I think what we need to do is let's get an X-ray, and then if this carries on, we need to refer you to the specialist, okay, in the hospital, okay?
Okay.
All right, then. So I'll probably see you in a couple of weeks. Get the X-ray done this week, and then
Yeah.
come back next week for the results. All right, take care, Bartos.
Thank you.
Bye.
Last Saturday, I collapsed twice at home. Now, I believe this is an ongoing problem with my blood pressure, which is running low.
Okay.
Now, for the most part, when I fall over,
Yeah.
and I do go down like, because I weigh about 15 stone, you go down hard.
Yeah.
This time I crashed into some furniture and I've hurt my ribs
Oh gosh.
around here in a big way.
Right. Okay. We'll definitely have a look at those.
And that's why I'm having trouble breathing, I'm having trouble laying down, I daren't cough.
Yeah. How long have you been having these episodes for?
On and off for months.
Months.
On and off.
Okay. So
I mean,
certainly before
the
you started
doctor,
this.
my normal doctor's alarm.
Yep.
They keep trying to juggle around my medication.
Right.
Every so often, it's not every week, but every so often I just black out.
Okay.
And it was twice on Saturday. Once I went over in the lounge, and that's where I crashed into some furniture. The other time, a little while later, I was in the kitchen, and bang, I was straight on the floor.
Been a while since I've seen you.
Getting older.
Yeah. Okay. But generally all right.
Can you give us help me to make you 21?
If I did, then I wouldn't be here. I'd be a rich man. I'd be sitting on a beach somewhere. Well done, you. Can I have a look at your card?
Are you going to show the doctor?
You gonna show me?
What you've done?
No. You're getting all shy now.
That's silly.
So, you've been trying to help your mum cleaning? Huh? Let's have a listen to your chest.
Should be a wheeze on the left upper side.
Very accurate. I've never had a patient tell me where to expect the wheeze. Who lives with you at home?
No one.
Nobody.
I'm on my own, you see. And it's getting more and more of a problem now.
So, your blood pressure's a bit all over the place today. Having looked at your previous results, so they've always been very, very well controlled, actually, your blood pressure.
It was last time.
Yeah, but there is still a bit of a drop when you stand up. Postural hypotension is a condition where the blood pressure suddenly drops very low when you go from a seating to a standing position. Low blood pressure can be just as harmful as high blood pressure, not necessarily in terms of the long-term health consequences, but particularly in the elderly groups, we worry about low blood pressure because it can lead to falls. Can I just have a listen to your heart? And just show me the area that your ribs were hurting.
Yeah.
Just here.
When I was walking yesterday, it felt like...
Show me the crest.
Yeah.
Just there.
Yeah. it felt like my lung was pinching on the bottom of the rib cage. So I didn't know whether I cracked my ribs or possibly broken something, I don't know.
There's two things I think we need to discuss. Number one, for the ribs, I think you've bruised them.
Yeah.
And we probably ought to give you something to help with the pain in the interim.
I'll be honest, how does that interfere with interact? I do drink.
Yeah.
I'm not alcohol dependent. I just drink
Okay,
to
okay.
enjoy.
Well, listen, I mean, I
See
think
what I mean? So I've got to be careful.
Absolutely.
With some medications that don't mix.
The choice is yours. If you're not keen to have the medication, that's fine. There's not an absolute reason why you shouldn't have a medication, but obviously you need to be careful with your drinking once you're taking these tablets. Yeah. Would you like me to prescribe you them?
Yeah.
Okay. As far as your blackouts are concerned, I think it definitely does need more investigation, and the clinic that you're going to is exactly the right place to be. Mr. Jones was referred to a specialist clinic where they investigate patients who have been having episodes of blacking out. Often investigations will include something like a 24-hour heart monitor, and once they've found the cause, they can offer the appropriate treatment. When you had these episodes the other day, did you have any chest pain or shortness of breath when you fell?
No.
That doesn't happen. So you just, one thing you know you're alert and you're awake, next thing you're on the floor.
Bang, you go down.
Yeah.
Okay, so.
Hopefully on Thursday they'll get the investigation sorted.
Okay.
All right.
That's good life.
Take care of yourself.
Thank you.
See ya.
Bye-bye.
Oh, just about to have his jabs. Oh dear.
Yeah, I know.
We need to find his appointment, don't we? He could be on the wrong day. I've got Wednesday at 10:30.
What day is today?
Tuesday.
Oh my God, it's the second, isn't it?
Sunday appointment.
It's my fault, baby brain, isn't it? So it's tomorrow.
Yeah.
I'm Dr. Bolger. Hi. Am I doing an 8-week check by any chance?
Yes. Yeah.
Congratulations. Who's this?
It's Navraj.
Hello. Looking absolutely enthralled with something. He was a section, I gather, yeah?
Yes.
Why was that?
Because they said my bone, pelvic,
Right, difficult pushing through.
Yeah.
Right, okay. Scars okay? Because I think we saw you, didn't we?
okay, yes, but I've got a little bit, like I get a leak.
From where?
From the stitches. So I think there's a tiny little hole that's open.
Let's have a look at that. Come across. Up onto the couch. And you're breastfeeding or bottle?
I am breastfeeding as well.
Breastfeeding,
Yeah.
good.
It's a really funny smell as well. So there's like blood and a little bit of pus.
There is a tiny little, like you say, a little bit where it's not completely together, but it's absolutely tiny. It's a tiny bit wet this morning. Right, come back across. Let's send the swab off, yeah? And then let's see if we do need to give you any antibiotics for that. There's no suggestion that that scar's breaking down, OK? There's a tiny little gap there. And what I'd expect it to do is heal from the bottom upwards. You obviously keep an eye on it. When the swab comes back, if we do need to give you antibiotics, then we'll know exactly what are the right ones to give you. OK? Birth control, do you need us to prescribe anything?
I actually haven't thought about what I want to do yet.
Have a think. What we can't give you at the moment is anything with estrogen in it, OK? So the pill that you take for 21 days and a week off, while you're breastfeeding, you can't have that. But the other things are fine. It's just something we want to mention at this stage so that you're aware of it. Yep.
Hello. 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 Hi, can I help?
I left the glasses in the doctor's room.
Oh no, that was silly, wasn't it?
Not first, not last time, madam.
No.
I've already been in to see the doctor. I've got an appointment tomorrow with the job centre, and he's told me that when I get home to phone them up, right? But I've explained to him that job centre people, they always need proof of this, proof of that.
Yeah. Who's next, please?
Come in. Take a seat. How can I help?
I'm ill. Nighttime coughing very much, sometimes block me to breathe, and pain too much over here.
How long for?
It started about 2 days ago.
2 days ago.
Yeah, I was drinking the lamp seed there.
Yeah.
And plus there I've got the liquid for all-in-one lamp seed as well.
Okay. You smoke?
Yeah, nothing from 3 days.
Okay. Any problems with your chest in the past?
No.
Nothing at all?
No.
Can I have a listen to your chest?
Of course.
You stand up for me. Do you want to come over here and just show me your throat? Just lean forward a bit, that's it. Have you had chest infections in the past?
No.
When you cough, you bring anything up?
Sometimes, not all the time.
And how much do you normally smoke?
Oh, it's about 10 cigarettes a day.
Okay. There's the odd noise on one side of your chest. I'm going to give you antibiotics, okay? It's not 100% sure that it's a chest infection, but there's enough here for me to justify doing it. Are you okay with penicillin?
Yeah, I think so, yeah.
Okay, take it easy and give up smoking. Yeah? Otherwise, you will get more of these for the rest of your life. Yeah? Good, slowly but surely. 10 a day for a week, 9 a day for a week, 8 a day. Get down to about 4 or 5, and then to look at yourself and go, do you want to live longer?
Okay.
Yeah? It's as simple as that, really. You need to confront it. You can try all of the patches and everything else. They can help, but fundamentally it's...
It's in the brain, I know.
Yeah, you've got to want it.
So...
There you go.
Thank you very much.
Okay.
Thank you, thank you.
See you later. Bye-bye.
Hiya.
Came in for my prescription yesterday. They said it'd be ready this morning.
McGraw, isn't it?
Very good.
I'm learning.
You're not an ex-wife of mine, are you? How did she remember my name?
Oh, you see, she remembers the good patients.
Well, probably, yeah.
So the man himself. Hello, gorgeous. Hello. Do you think it might be worth a little smile? Yes, absolutely. So, start at the top and work down. Soft spot there, which is normal, that's fine. Baby's born with 2, and the back corner's closed up, which is normal at this age. No lumps or bumps you're concerned about?
I haven't actually.
You haven't noticed? Want to sit up for me? That's really not bad head control, is it?
Oh, he's been controlling
I think
his head
that's
since
really rather
day
good.
one.
Let's drop you back very carefully. And he still startles, which is normal at that age. What do you think? Okay, sweetheart.
Like head.
Do you not like that? Goodness!
Put a hat on.
You don't like hats? You're not going to be a hat baby? Poor soul. Oh. Right, I'm going to let your mummy put that nappy on because we're dicing with death here, really, aren't we? That is a completely normal examination, OK? Everything there that should be, everything doing everything it should. Lovely. So, he is fit for his immunisations. That swab will go off. We'll let you know if there's any problem.
Yeah.
You'll have a think about what you want to do for birth control. You'll keep an eye on the scar if you're concerned. You'll call us again, OK?
Sure.
Great.
Thank you for your time.
It's no problem. He's lovely.
Later.
Take care. Bye-bye.
We have pen thieves around here, don't we?
We do.
And they're usually called the doctors.
I had a nice blue and white one, just put it down, went somewhere and it's gone. Never found it.
I used to put it in my hair like that.
Yeah.
And then the doctors... So now I hold it and don't let them have
Stick
it.
it in the bra between the... Get your hand slapped. Yeah, definitely.
Come on, grab a seat. Ooh, you're wrapped up well. It's cold out there, isn't it? Right, what can we do then for you?
There's a few things for me.
Okay, let's see how many we can get through then in the 10 minutes.
Okay.
Right, start with the most important.
The most important thing that I'm worried about is that since 2 weeks ago,
Yeah.
I've been going to sleep and my pillow has been full of blood
Okay.
from my mouth. 2 weeks ago wasn't so bad, but now it's getting worse. Where I have to put a towel.
Are you sure it's your mouth?
It's my mouth, yeah.
Not your nose or your ear?
No.
Are you sleeping all right at night?
Yeah. Well, getting in the middle of the night, I'm like feeding little man. So.
Yeah, okay. And what's the other thing then? Anything else?
I'm feeling. Sometimes I feel like I'm anxious.
Yeah.
I when I'm in the like if I've got to do something, I get really like agitated, like really like panicky for no reason. I like my mood just changes. Like next minute I could be all like bubbly, and the next minute I'm having like a come down and I'm like taking it out on people. Like I'm just going crazy. To be.
I think. Well, I don't think you're going crazy, but I do think you're under quite a lot of stress.
I'm just feeling like I don't know. I just need something just to calm me down.
Okay.
Do you know what I mean? And I don't usually do that. I'm very old school. I usually just get on with it.
Yeah.
But now it's getting to the point where.
Yeah.
I need some sort of help.
Right.
Wow, you brought your bike.
If you're driving, then make sure you have glasses.
I'll use them.
All right, okay.
So how are you being?
Well, pretty lousy at the moment. I've got a chest infection, aeroplanitis.
I'm a terrible traveller. Don't like flying, so I've decided I'm not going anywhere.
Do you feel sick on?
I hate it. I hate flying. I went to America and I hated every single minute of the flight. I just wouldn't move. My hands were just like... I hated
Oh, bless you.
Often people, when they feel like this, feel sometimes that life's not worth living. Have you felt like that at all? Have you done anything about it?
The thing is, I felt like that when I had my first daughter. She's 11 now. I felt like I just wanted to give up, basically. And there's no reason for me to feel like that, if you get what I mean. But
What would stop you doing anything like that?
my kids.
Yeah, good. And remember that, so it's always...
I keep thinking about my kids.
Yeah. Let me just look in your mouth to see if there's anything I can see first, and then we'll talk about the other. Okay. Just open wide. That's fine. And then this is a bit awful, but I'm just going to stick it up your nose and have a look. Sorry. Okay, that's fine. I mean, that all looks fine. I can't see anything in your mouth, but then I can't do a proper exam. You might want to sort of see a dentist about getting the proper exam of your mouth done. What I am worried about is obviously you're feeling very tired, you're a bit low, and you're sort of very down. I'm going to just ask that we do some blood tests. And some of the blood tests will look at see whether you're clotting and the blood is all sort of clotting right to make sure there's no problem with your blood system, if you like. But
I
having
haven't
said,
got cancer, have I?
I don't think you've got cancer. But one of the markers we do is a marker of general inflammation, which
That's
helps
what I'm
us.
stressing.
But that helps us rule out things like cancer.
Okay.
Okay. But I think it's important to see the dentist ASAP, and you'll get free dental treatment because you've been, pregnant in the last year. I do think you need a little bit of help, and I think, it might be worth looking at getting some talking therapies where they'll sort of speak to you and help you with that. Maybe getting to the stage where you need to take something to help feel a little bit better, a little calm down. Now, we can wait and see if talking therapies help, or you can sort of start that and do the talking therapies as well.
Can I just take, can you?
I can give you something to take if that's for you.
I just want to just...
Feel a bit calmer.
Yeah.
Okay.
I don't want to be...
Yeah. What I'll do is, because you're low, I will give you one of the antidepressants that we use to lift the mood, but it also is used for people who are just generally very anxious.
Obviously, now I'm being busy.
You're a little better, do you think?
A
or
little bit better, but the mood is like, I just start getting all angry for no reason and just...
Okay.
Like I said, it's probably a big change.
I think it's, you've got a lot of stress and, the bleeding and stuff. It may be that you're just biting your tongue or biting your cheek, and that's why it's come from. If it was something that was there all the time, I'd be much more worried about things like anything cancerous. Okay. But as I said, some of the bloods will help us decide whether that is the case. And if you ask at reception, you try and see if we can book you in for that, and also ask them for the talking therapies number as well, because they have it. Okay? There's a lot to remember, but the dental thing is important. Okay.
Thank you very much.
You're very welcome. Take care.
Thank you.
Look after yourself. Now, if you're struggling, come back sooner.
I will.
Okay?
Thank you very much.
Bye-bye.
I've got a headache. I want a Dr. Cuddle.
No, you can't have a Dr. Cuddle.
I've got a cuddle off Dr.
Call Dr. Ward.
I did.
Apparently, if you feel unwell, you've got a headache, a Dr. Cuddle makes it go away. So she literally
had a cuddle.
Dr. Ward. You need to do that, don't you?
Here we come. Come and take a seat.
Keely said, hello, Claudette, us again. Like the family's day out every week. Reece, let Nan sit there, you sit over there.
Right, so your asthma's playing up, is that right? Sounds like a frog.
Dr. Ward, she has had this so long, we just don't know what to do. Last year, she was really, really ill. She lost so much time off school because they sent her home as well. We were sending her.
Yeah.
And they can't have her because it's disrupting the class. But it's upsetting her.
Sure. The problem you get is that we can't prevent bugs from coming along.
Yeah, because her immune system, I think, is low.
Well, it's not even that, is it? You know, she's got an underlying chest thing.
So damp.
You don't catch them from the house. You get them from other people at school.
Is it?
Yeah. Have a stand up for me. I need to listen to your back, yes?
Stand up, babe.
OK, the problem is that coughs always sound bad.
Yeah.
OK, and it's not the coughing. It's not the coughing that we worry about. It's what the breathing is like when they're not coughing. Yeah. OK, so at the moment, let's take that off, can we? OK, deep breaths through your mouth.
Listen to her chest.
OK, good. That'll do it.
Do you think it's... They said she had croup up vaccine every time we take her.
Yeah, that sounds like croup to me.
Yeah, and we said only babies get croup.
No,
they said
it's a variable feast. You can get it. And I think it is croup because if you listen to it, it sounds like a... Yeah, it's like a seal barking, isn't it?
Yeah, yeah.
The good news is the chest is really clear.
So that's good.
OK, it is. So what I worry about asthma is when the reaction to the bug that comes along affects the breathing to the point where you really wheeze, you've got a tight chest, so you're going, you know, and you can tell by the breathing. So the breathing at the moment is really good, OK? This is all up here at the moment, OK? This is all...
Right.
And it's related, it's around the vocal cords, which is why you get that strange sound. So drinking fluids is important, paracetamol for fevers or temperatures, OK?
Yeah.
And that's what she needs.
And stick to her medication that
and
she's
really
got.
stick to what's going on
listen to this. Sometimes she don't take it, and we really go on like her.
Her chest is good though at the moment, OK? So those inhalers are doing what they need to. They can't do anything about the croup. That croup is there until the immune system gets in.
Because last year, obviously, it was such a worry. She was so ill.
See how she goes. If her breathing starts getting worse, then we must see her, OK?
Yeah. What about if I got her some cough lincers?
Makes no difference whatsoever. Waste of money.
She steamed herself this morning in the
Steaming is good.
bar.
Steaming is good.
Did you feel better after that?
It'll help a little bit. It's just there to
She's
aid.
very good at doing her stuff and that.
Good on her.
Just worry in case, you know, make sure before it takes her home. What do you say, Keely? Thank you, Dr. Ward.
Bye-bye.
Say bye, Reece.
See you, Reece.
Bye.
Bye.
So, Keely, you must carry on with your medication and you have got croup.
Bye-bye.
Thanks, bye-bye.
That's for you.
Thank you.
No problem. Bye-bye.
Bye.
There you go, Maureen.
Thanks a lot, lovely.
Have a nice weekend.
Yeah, sure I will.
Take it easy.
Thank you.